Hello, my name's Jo Ginger and I'm an advanced clinical practitioner with the respiratory team at Warrington and Halton Teaching Hospitals. This is Katie and together we're going to demonstrate how to use your dry powder inhaler. These instructions apply to all inhalers that look like this, regardless of the medication within the device. When taking any inhaled medication, a good position is required to enable the most medication to reach the lungs and to get the best effect from your inhaler. Ideally, it's always better to stand up, if not sit upright. Relax your shoulders down and tilt your head up slightly. Nexthaler. With these devices, you need to keep them at room air for a minimum of 1 hour before use. Prepare the device and the dose. Slide the protective cap round until a click is heard. The dose counter will go down by 1 dose. Check how many doses are left to ensure your inhaler is not empty. In one smooth action, breathe out gently and slowly away from the inhaler until your lungs feel empty. Tilt the chin up slightly, place the inhaler in the mouth and seal the lips around the device. Breathe in quickly and deeply. A click during inspiration will inform you that you've completed the correct inhalation. Remove the inhaler from the mouth and hold the breath for 10 seconds or as long as comfortably possible. Breathe out slowly and gently. This device has certain feedback signals to reassure you that you've taken the full dose. Firstly, there's a lactose taste when you take the inhaler. The dose counter does not move when the dose is prepared. Rather, the dose counter will only go down after delivery. You can clean the mouthpiece if needed using a dry tissue before you close the cover. Routine cleaning is not required. Slide the cover up and over the mouthpiece as far as it will go. After you've used any inhaler device, rinse your mouth out with water and spit it out. This is especially important if your inhaler contains a steroid. Always use your inhaler as prescribed by your clinician. Try not to miss a dose, but if you do, don't double up. Restart from the next dose. Some people find setting alarms on their phone or leaving their inhaler in a location they use at that time of day, such as near the toothbrush, as a good way to remember to take them. If your inhaler is an as-required prescription, make sure you take your inhaler with you wherever you go. It's better to have it and not need it, rather than need it and not have it. Always order repeat inhalers well in advance, so you don't risk running out. Be aware of forthcoming bank holidays. Make sure you have sufficient inhalers to last every day of your holidays. Always keep dust caps and covers on your inhalers to reduce the risk of dirt and debris going onto your inhaler. Store all inhalers as per manufacturer's instructions. And lastly, if you have any concerns, speak to your clinician.